Hi, I am Dr. Deepak N. Namdar. I am a senior consultant orthopedic and robotic joint replacement surgeon. Are there any permanent restrictions after knee replacement surgery? Yes, we would advise you not to squat on the floor, not to sit cross-legged on the floor, not to use Indian style of toilet, because even though it can be done in some patients, it reduces the longevity of your knee replacement. So these are things we would advise you not to do. The rest of the things can be done. You can go for a walk, you can play golf, you can play doubles tennis. So these are the things which can be done, but not to squat or sit cross-legged like in the Indian style of toilet. The precautions to be taken after knee replacement surgery, what I would advise in the immediate period, lots of icing. For every hour one needs to take 20 minutes of ice. So one can divide that 1 hour every day into 3 periods. 20 minutes rest, 20 minutes ice and 20 minutes activity. That's the first thing. The second thing is limb elevation. So keep it elevated over a pillow in the bed. The third thing, I would like you to be as active as possible. Keep moving your ankle, toes, contracting your kneecaps. Fourth, whenever you sit for breakfast, lunch or dinner, hang your legs down at the edge of the bed and sit. Fifth, keep doing the exercises which we have taught or the physiotherapist has taught you regularly, so that it can strengthen the knee and you can get back good range of movements after the surgery. So all of these things are important as your post-operative protocol apart from the medicines you take after knee replacement surgery. The usual recovery time after a knee replacement surgery varies from person to person, but the average I would put it at around 6 weeks. By the time a patient becomes completely pain free, it will take nearly 3 to 6 months, so one need not worry if he has some pain. One needs to continue icing after the knee replacement surgery. There might be some redness which is seen, especially if the person is a little fair. So please continue icing, please continue with the exercises. This will help you in very good recovery after knee replacement surgery. So what should one not do after knee replacement surgery? I have already told you earlier. Avoid squatting on the floor, avoid sitting cross-legged, or avoid activities which involve deep knee bends. So please do not do such things after knee replacement surgery. Most of the activities which you had done before knee replacements can be done after knee replacement surgery. In fact, I had an 85-year-old after knee replacement surgery. She had undergone both the knees. She went all the way from Bangalore to New York alone in her flight and traveled all the way everywhere in New York. So that is the amount of freedom which one gets after knee replacement surgery for a 85-year-old. So one can do everything pretty much after knee replacement surgery. The usual period of recovery after knee replacement is around 6 weeks. We advise walker for a period of 3 weeks, followed by walking stick for a period of another 3 weeks, after which we make them independent. But there are patients who get rid of the walker and walking stick much earlier, and there are few of them who require it for a longer duration. It depends on how fit the person is, how mentally strong that person is. So the usual time frame for recovery can be put at around 6 weeks to 3 months after surgery. The speed of walking after knee replacement surgery is the speed at which you are comfortable with. There is no predetermined speed which we suggest, but one can walk comfortably as much as he or she is capable of doing. As to how much you can walk, as much as it is possible for you. There are patients who walk around 5 to 6 kilometers after knee replacement, so that shouldn't be a hindrance at all. The only thing is, especially if you are walking on uneven surfaces, one needs to be careful, because the ligament responsible for sensation is taken off during the surgery, so one needs to be careful with regards to that. We do not advise you to sit cross-legged after knee replacement surgery. So sitting cross-legged is one thing, especially among Indians who sit on their haunches or use Indian style of toilet. This is something which needs to be avoided. Even though if they can, this needs to be avoided. So in those of you who are allergic to metal, we have special implants which are now available, which uses a special coating. As to the sensitivity present in front of the knee, it is quite common because the skin nerves which are cut during the surgery, it definitely gets improved over a period of time. We give some medication to take care of that. One need not worry regarding it. There are some patients who do have pain and sleepless nights after knee replacement surgery. So at present there are fantastic medications which are available to take care of that. Along with good amount of icing, it settles by a period of around 3 to 6 months. So one need not hesitate or worry regarding this part.